manufacturers refurbish, upgrade, test, and reuse parts from professional healthcare equipment. What are some of the success stories within the industry? So that's a really interesting question. And it's something if we look back on our past, we did reuse medical devices quite a bit more frequently than we did back in the 50s and the 60s. Today, medical device and medtech companies provide service and repair options to their healthcare customers. And recently, they very much expanded on these offerings. So we work with a number of the leading providers of endoscopes. Endoscopes are these long, flexible devices that have a camera on the end and allow doctors to look inside the body with minimal invasion, whether that's a laparoscopic surgery in the gut or whether that's looking into the lungs or what have you. Recently, the FDA has worked with the leading providers of endoscopes to find ways in which those devices can be reused and safely cleaned, disinfected, and reused within that hospital setting. What these leading endoscope manufacturers are doing is really looking at how do we balance the safety to the patient from infection control, along with when is it the best approach, either from a safety or from a sustainability perspective, to utilize single-use endoscopes. And both have their benefits, both from a safety and from a sustainability perspective. Sometimes cleaning is more effective, other times single-use is more effective from a sustainability perspective. It may seem paradoxical, but in some cases the cleaning process actually uses more environmental materials such as water, solvent systems than it does to produce a single-use device. Secondly, we work with Stryker. And Stryker has a huge array of products that they offer to the healthcare system. Everything from wheelchairs and stretchers that go into ambulances to robots and knee replacements that go into patients. One of the things that they really have as a unique offering is the ability to refurbish and remanufacture a number of those high capital cost equipment for hospitals. In fact, they're often able to remanufacture, refurbish these devices at 60% of the original cost to the hospital. So that device that they've spent millions of dollars on, they're able to get at 60% of that cost. Now, not only does this provide sustainability from an environmental perspective, but it also provides sustainability from the cost and affordability of healthcare. If the hospital doesn't have to spend another $10 million on a new piece of medical equipment in the hospital, they're able to pass those savings on to patients and provide healthcare at more affordable prices. And finally, nonprofits are also taking advantage of refurbishing and remanufacturing of medical equipment. Nonprofits are able to purchase refurbished equipment at much lower costs. For example, what Stryker's doing with lowering the cost of refurbished equipment to 60% of its original cost. What's important there for nonprofits is that they can then take that advanced medical device and treatment and bring it to parts of the globe that have less accessible healthcare settings in a much more accessible and equitable fashion, really focusing on the equity of our sustainability goals for healthcare.